so explain to me what it is.
As Dr. Walter Urba walks through the lab at Providence Cancer Research Center, he can take satisfaction in knowing he helped build this operation essentially from the ground up over the past 2 decades. In a city where the hospital on the hill likes to grab headlines, Urba has put Providence on the map.
So when you go back and work with the scientists in the lab and the physicians who are part lab, part doctor, it's just an incredibly intellectually stimulating environment.
Urba may collect accolades for his work developing cancer treatments, but he still draws passion from working with individual patients.
It's a wonderful journey to be on with patients. It's a wonderful outcome to share.
So there's the reason to live right there.
Mark Hornibrook sought out Urba when he was diagnosed with cancer.
I was diagnosed with metastatic melanoma on February of 2012.
When Mark first met Dr. Urba, scans of his body looked like this. Those dark spots are tumors.
Tumor here, tumor there, 6 tumors in the muscle tissue around here, innumerable tumors in both lungs. Let's play.
The cancer still lurks in Mark's body, but thanks to treatment from Dr. Urba and his team, the tumors are gone.
Dr. Urba impressed us, one, as a very caring, comfortable person to be with, and probably most important, he knew the latest of whatever was going on in the industry. Do you want to go up the path?
Mark's initial prognosis was not good. He was given, at most, a year to live, but realistically, he was told to expect maybe a few months. Just 60 years old, he made peace with the fact the end was near and his large family would lose its patriarch.
Oh.
His wife Anne, however, could not come to terms with her husband's disease and urged him to fight.
You know, I remember walking into a grocery store, and right outside the store they had a bunch of tulips, which is my wife's favorite flower, and just struck myself, who's going to buy her tulips? And I know her children would, but it's not the same. And then thinking about the grandchildren and not having that time to play with them and build things together and swing together, it just, so.
Over the past 2.5 years, Dr. Urba has guided Mark and his family through a series of treatments.
Woo!
Each successful treatment buys time.
You're doing it.
And when it comes to cancer treatment, time is the best currency.
Lean back. Dr. Urba is just saying stall, stall, stall. You know, the longer you can stall, the better the chance you have of getting a drug that's going to have a high percentage chance of cure.
Even in the months since Mark started his most recent treatment, a new, more promising drug is already in use.
One that Dr. Urba and his team, again, have been through the clinicals with, and they were part of the type of research that the immunotherapy, it is an immunotherapy drug, and it's a new one that's come out, and instead of that 6% cure rate, now we're talking 25 to 35% cure rate.
There's not much greater reward than being able to provide a treatment regimen that leads to the ultimate success, which is cure of the patient with cancer.
Urba's path to Providence started with a phone call in the early 90s.
When they first called on the phone and said, gee, we want to do some research, I had this vision of a small lab with a Bunsen burner and a hospital administrator thinking that was a lab and you could do cancer research there.
But what he found was a real lab and a real commitment to world-class cancer research, including the budding field of immunotherapy. Urba's motivation to grow the cancer center can be traced back to his mother, who battled breast cancer for decades.
You know, your mom's a pretty big influence in your life, and it has had a way of helping me set priorities.
For Urba, those priorities include always being straightforward with his patients, even when the news is bad.
Watching her go through the anxiety, I think it's made me call patients back sooner. It's made me respect to a much higher degree what's going on in their lives at home.
He's always quickly responding. When he finds out what's happened on a test result, he emails us right away.
Urba's work in the lab and with patients helped lead to breakthroughs in treating melanoma and other cancers.
They've been working on immunotherapy since the early 90s, and it wasn't popular then. Now it's seen as the direction for the cures.
Urba is often praised for research breakthroughs, but when asked what he finds rewarding, the doctor is quick to talk about his individual patients.
It's a obviously a great day when you look at that x-ray in a patient who's been fighting really hard for their disease, and you put that x-ray up there and their tumor's gone. Hard to get a better day than that.